We're facing an epidemic in this country about substance abuse issues and mental health care. There's a lot to be said about the care for people struggling with these issues, but I want to talk about the financial aspects and how we pay for it. I have helped too many people who have struggled financially by having to pay tens, if not hundreds of thousands of dollars up front to get their loved one cared for. It's ridiculous. It can be financially devastating. So today, in this episode of Healthcare Hacks, I want to talk to you about what you can do and how you can protect your family from incredibly large bills for mental health and substance abuse care. Hi, my name is John. I'm your healthcare hacker and a believer that we need to change our mental health system here in the US. Before I get started and talk about how you can protect yourself and your family, please take a minute, hammer that like button, subscribe to our channels, follow us on whatever social media platform you use. We want to get our message out. We want to get our information out to as many people as possible around how to navigate through the complex US healthcare system. And you can help us by liking our content. One of the biggest areas where I see issues that families face with large bills related to mental health and substance abuse is around out-of-network. Specifically, they go to an out-of-network provider. What's really interesting, and I think kind of sad, is a lot of providers in our country that offer residential treatment and inpatient therapy for substance abuse and mental health don't take insurance. They don't bill insurance. They leave it up to you, the patient or the patient's family, to get the claim submitted to insurance and hopefully get reimbursed. I mean, it's even worse because they ask you to pay up front out of your own pocket or put it on a credit card, hundreds of dollars a day, and then hope that you're going to get reimbursed. You have no control over this. And family members, I know myself, if Mrs. Healthcare Hacker or one of my kids need this type of care, I'd pay anything. And I see so many families do that. What I tell people is this is a gigantic investment that you're going to make. Probably besides your house, the largest single investment you're going to make for you and your family. So do your research. I know it's hard. There's usually a crisis going on. But figure out where an in-network facility is, if at all possible, and understand your financial risk if you do go out of network. Because it can be incredibly large, and there are good in-network facilities. So call your insurance company, make sure that you can find a facility that meets your loved one's needs, and hopefully won't leave you financially at risk. A second way that I see families struggle with high cost of mental health or substance abuse facilities is around penalties. A lot of insurance companies require individuals to let them know that they've been admitted to one of these facilities within a certain time period. 72 hours is usually pretty typical. If you don't do that, what they're going to get reimbursed, what you're going to be financially responsible for, is going to be more. So make sure, especially if you're going to go to an out-of-network facility, that you call your insurance company or let them know that your loved one's being sent to this facility. Make sure that it's a facility that is going to be covered and that they know that you're going to an inpatient or residential. So there's no surprises and you don't get hit with some sort of penalty that you weren't expecting. The final issue that I see a lot of families struggle with is when your doctor and your insurance company don't agree on the right level of care for your loved one. For example, the doctor might say, hey, John's a risk for himself. You need to have him in an inpatient facility. But the insurance company says, no, we disagree. It's frustrating. And if you listen to your doctor, you might have to pay tens of thousands of dollars because your insurance company's going to deny it. If you listen to the insurance company, maybe your loved one needs the care. And they're not going to get better. They might get worse. They might harm themselves. It's a scary situation if you've got a loved one that's kind of stuck in this limbo. Well, there is something you can do about it. It's about taking ownership and getting yourself in the middle of that conversation. You need to make sure that your insurance company and your doctor have a conversation and that you're part of that conversation. Because at the end, you're the one that's going to be dealing with the consequences, not the doctor, not the insurance company, you and your family. And financially, this can be very big. So I tell members, make it a three-way call. Get everybody on the phone and have a conversation. You want people to understand everyone's perspective and make sure that your loved one gets the care they need at the appropriate level, and so you're not paying more than you need to. Mental health and substance abuse still carry a stigma in our country, but the financial side shouldn't. Remember, if you or a loved one needs care, make sure that first, try to go in network if possible. Second, make sure you notify your insurance company if you do need care. And third, and finally, if there's an argument, if there's a disagreement between your insurance company and doctor, make sure you make them talk and you be part of that conversation. It's so important. It's an easy way you can protect yourself from large financial bills. If you have any questions or comments about this episode, please leave them in the comments below. We'll try to address them in a future episode of Healthcare Hacks. And as always, make sure you get the facts by joining me in the next episode of Healthcare Hacks.